Thanks for staying with us. So we celebrate we actually commemorate sickle cell every year. So sickle cell disease is one of the most prevalent public health issues in Nigeria, which is known to have the greatest number of sickle cell disease patients per country in the world.
Wow.
However, this month happens to be Sickle Cell Awareness Month, and we'll be discussing the plight of sickle cell in Nigeria, management of sickle cell, and much needed sensitization exercise. Joining us on the show is the founder and CEO of CrimsonBow Sickle Cell Initiative, Timi Edwin. Good morning, Timi. How are you there?
I'm very well, thank you. How are you doing?
Good, good. So we always know that people who get into the Sickle Cell Initiative always have a story behind why they started this. So could you give us in a nutshell how you came, what made you start this initiative?
Well, I live with sickle cell. I've lived with sickle cell all my life. Apart from that, my late mom also lived with sickle cell. What made me come into this place, where I am right now, is the fact that I was about to, about 6-7 years ago, I was about to get married. I mean, we have been in a relationship for about 2 years. And I mean, the guy just walked away. He said, after, proposing and everything, he said he couldn't go on anymore. And I asked him why. He told me he couldn't just cope with sickle cell. And that's, of course, that was a moment where I reached rock bottom and then decided that, the only way to go is up and to be able to sensitize people, to be able to make people aware of the condition. It's not a death sentence. It's not something it's not a plague, So that's why I came into what I'm doing right now.
So what's the message you would say? Because there are different arguments that it's better not even get into a sickle cell conversation with people because it can be very, very sensitive. So in your view, how is your initiative helping to commemorate sickle cell today?
Well, what we're doing is we create awareness. Sickle cell is a sensitive topic, but it's only sensitive because there's a stigmatization attached to it. Right. How do we break the stigmatization? By talking about it. We can't keep hushing up about it. Fortunately, there are a lot more people, a lot more advocates, a lot more people who live with the condition coming out to say that they live with the condition. There's a lot more, people are talking about it, that even the Senate, Senate and even state governments are beginning to talk about it and see how they can affect the condition. So what we are doing to commemorate Sickle Cell Awareness Month is by creating awareness. We also conducted on Saturday free genotype tests for people who didn't know about their condition. We had a clinic for people living with the sickle cell, just to show that we care, just to show that we love them, just to show people that we are there for them, and
right.
we should stop keeping quiet about the condition.
Okay.
So sad to hear about your story. That's a really sad story. In that kind of situation, what would you advise the spouse, that is coming into a marriage with somebody who has sickle cell? Because I think the guy wasn't really informed.
Yes, so I'm not here to underplay the condition. And then another thing, sickle cell affects people very differently. I'm one of the fortunate ones that probably doesn't get ill as much as other people. But that being said, sickle cell is a very serious condition. I would advise that whoever is interested in dating someone with sickle cell should get informed, should get to know about the condition, talk to a doctor, and get the right information, because there's a lot of information out there. People have this notion that people living with sickle cell would die at any time, they can't give birth, there's a lot of things around it. They can't do anything. They can't do house chores, So I'll advise whoever that wants to see someone who lives with condition to get informed, and then also have a proper conversation with this person. Discuss your fears, because if you discuss your fears, this other person will be able to either make light of talk about it, and there'll be communication. Communication bridges several gaps. But what a lot of people do is they keep it to themselves. Maybe they're talking to their family members, or maybe they have some sort of experience in the past, and then they judge whoever they're about to go into a relationship with based on that.
Right.
This is absolutely wrong, and this shouldn't be done.
Right.
Just talk about it, but also seek medical care. Medical advice, rather.
Okay.
All right, so I was at the hospital recently, that was last week, to see a friend's daughter. And I got there, I saw 2 other kids. It was the children's ward. And I saw 2 other kids undergoing their crisis, what you people call crisis. And it was heartbreaking. It was really heartbreaking. I wouldn't wish it on my enemy from what I saw. So in this initiative, is there any form of awareness that is created? Prevention. Yes, for prevention, most especially, aside from, people learning how to manage and deal with people who have it. Are we focusing on the prevention?
Oh, yes, we focus on prevention. Like I mentioned earlier, we create awareness. So what we do is we go from local government to local government, we go to communities, we go to religious houses, and just to talk about what people should do to avoid bringing children with the condition. And we also talk to people, less peradventure people who are not genotype compatible but got married all the same. There are also procedures, there are also things that one can do, to avoid bringing children living with sickle cell into the world. So we create awareness, we talk to people, we also equip people with genotype tests, because we also find out that not everybody has access to the hospital. That's why we take genotype tests to the communities. We let them know that in case you do not know your genotype, please come and get tested. Come and get, and it's for free. We will let you know what your genotype test is. We also advise people that even if you know your genotype, because there are also stories of people who thought they were AA, but end up being AS. And they thought so because they probably went to one hospital or the other, got their test done and got wrong results. So it's always good to also confirm the results. So we advise people to not just know it once, but know it at least twice before taking the step of bringing children into the world.
Okay, so I wanted to ask you, as someone that, as a carrier, not just a carrier, it's an emotional burden. And I want to ask you to talk to other people who are probably about to go into a relationship or are entering that zone where they want to start dating, and they know that they have their health challenges. What would you say, what would be the right mindset for them to have? Should they approach every person that comes to them or anybody and say, I have SS, I tend to have health crises, or should they just live normal lives like nothing is happening to them health-wise? How would you advise them to go about it?
Okay, I will advise carriers like myself that sometimes we make our lives all about sickle cell. Life can be a lot much more. I mean, if people come to you for relationships and they say that there's a lot more to you, like you have a good job, or you have a business that is you are managing, you are happy, there's joy around you, they would feel that they can approach you, you become approachable to people. However, I will also advise that you share your story and educate as many people as possible around you, because your story can change and encourage people. I mean, there are still so many parents that have sickle cell children that hide these children, and then these children grow up feeling ashamed of themselves or feeling ashamed of their conditions. If we keep talking about it, we will, end the stigmatization attached to it. However, if you feel like you've been stigmatized, I want to advise that seek help psychologically, because I had to seek help. I had to realize that there's a lot more to me than sickle cell. There's really a lot more to me. So I also decided to invest in every other area of my life, and just live my life to the fullest. So I advise that please live your life to the fullest. Let people are attracted to positivity, people are attracted to light. Show light through your life.
I wanted to ask this question. Is there a way to prevent the crisis from coming? Is there maybe foods that you can eat or something to prevent this crisis from coming?
Yes, so there's a lot of things about nutrition now that is going around. So yes, we'll say eat healthy, but apart from eating healthy, there's a lot of medication. So before I was 25, I used to fall ill, and this, fortunately, this was when I was dating the person that broke my heart. I used to fall ill a lot. And at that time, he spoke to me. I was like, you know that as you fall ill, you're affecting it's not just you that is being affected, but your loved ones, because they have to take care of you. You need to know how to take care of yourself. So I decided to do a lot of research, and I found out that there are sickle cell specialized clinics in Nigeria, and I joined one. By joining one, I was able to know the right kind of medication to use, the right dosage of medication to use. I also sometimes feel like I'm a superwoman. So I also have to remind myself totally all the time that I need to rest. You need to take adequate rest. you need to avoid extreme weather conditions. When it's like right now, it's raining season, so it would be nice to go around with a jacket or a hot water bottle or some like some rub or menthol products that you could use to keep yourself warm. It will also be nice to also make sure that you are happy. Because sometimes a lot of people fall ill when they are not happy, when they are sad. So it will be good to ensure that your mental health is always on point, is always good.
All right. Okay, so let me be just clear on what your message is. So your message is for those who already live with sickle cell, you want them to be happy and know that there are options out there of healthy food they can eat. Maybe they can join groups where they can get better information on how to take care of themselves. And those who are getting into relationships, they can also be more informed, because if you actually fall in love with somebody with sickle cell, there are procedures you can go through to ensure you don't have children carrying the sickle cell. Is that correct?
Yes.
Right.
Yes.
So that's an interesting angle. I didn't hear that part before.
Okay. I wanted to quickly ask another question. There was this very touching movie that brought another angle to how we see carriers of sickle cell, and I'm sure you're aware of the movie by Tunde Kilani. And
Yes.
How are you trying to use other things like that, using movies, using music, getting influencers, getting people to show the life, show the journey? Because what we see most of the time is the sickness. We don't see that there is a life. There are stories that can be told around it. So what is your what's your own NGO doing to generate that kind of awareness as opposed to just saying inform you, inform you, inform you?
Okay, we actually produced a short film recently that is going to be launched very soon. I mean, that short film also brings even a different angle to sickle cell. We produced a short film. We're in the process of also doing a radio drama series. And apart from the radio drama series, yes, a 5-minute radio drama series weekly that would just educate people on different aspects of sickle cell prevention and management. So it doesn't just apply to people living with sickle cell, but people who do not live with sickle cell, or people who are in precarious situations. Apart from that, we also have been on different media. We've done like media rounds to just educate people about the condition, like we are here, as you graciously allowed us to. We also we do a lot of grassroots network as well. But I would also like to say that there are other NGOs that have radio programs as well that try to educate people about the condition as well.
Right.
So right now, you see that even a lot more people are coming out. Right. Like you said, people are there are people that always tag us on social media saying that they sang a song about the condition just to create light.
Right.
This we're doing, if you look at HIV, for instance, HIV was so prevalent at some point in the country, but how the stigmatization and even people just I knew a lot of people that had HIV at that time as well. And we will see that the statistics has dropped drastically because there were movies out there, there were series, there were so many, there was a lot of information, there were billboards and all that. So we're trying to take that part as well.
Thank you so much, Timi, for joining us this morning. Appreciate you. And we wish you all the best with your NGO. We've been speaking with the founder and CEO, CrimsonBow Sickle Cell Initiative, Timi Edwin. Okay, ladies, I think that's all we can take on the show today.
Yes. That was a good show.
Please don't forget that advice the Chicago woman said.
Yeah.
If they slap you once, get an exit bag. Find somewhere to keep that bag so that you carry your 2 legs just in case the second one comes. Have a fabulous day. We'll see you tomorrow. Bye for now.
You can watch Your View on TVC every Monday to Friday, 9 a.m. to 10:30 a.m. Nigerian time on DSTV channel 418, GOTV channel 27 and channel 47, StarTimes channel 121 and channel 307, Play TV channel 801 and channel 190, UHF 49, Sky channel 515 for UK viewers. Watch live on Facebook at TVC Connect and on our website tvcentertainment.tv/livestream.